Hello everyone, my name is Eden Bootler. I'm with the Regional Municipality of Wood Buffalo Communications team. I'm here today with Director of Emergency Management, Scott Davis, so we can talk a little bit about the role of emergency management in COVID-19. How are you doing today, Scott?
Great, Eden. Appreciate the distancing we've got going here.
Yeah, I think it meets quota, right?
Yeah.
Cool. So I think we'll just start off. I just want you to define your role as Director of Emergency Management so that the people at home can kind of understand what your job is, how you serve the community, what your team does, and how that applies to COVID-19.
Great question. So as a Director of Emergency Management, it is a legislated position that under the Emergency Management Act of Alberta, that each community has a Director of Emergency Management who has the powers under the Act to work with the community in times of need, such as this, whether we're in a state of emergency or just ongoing preparation phase. And when we look at emergency management, we really look at that preparedness, response, recovery, and of course all of the work that's done prior to that to get ready.
Sure. So I know that your branch works with a lot of partners, especially with COVID-19, and you're connected provincially and you work with the experts. Can you kind of let the public know who you're working with and how that kind of chain of command flows when it comes to sharing the information with the community?
A lot of different partners, and when we look at, and I don't want to miss anybody and feel real bad, but you know, we look at Salvation Army, we look at Red Cross, we look at St. John Ambulance, St. Aidan's, there's the SPSA looking after pets, and then there are a whole host of different organizations in each community. Some of them are community-based. So really those ones, they help us get the messaging, and working with those partners, they again know their residents, and we can reach out to them. The other thing is with First Nations, they are their own communities, but we keep the dialogue open with them, respecting their protocols and procedures. And we work with Alberta First Nations field officers, as well as whoever the chief in those First Nations designates to be their point person. We try to work with them to let them know what we're doing and also understand what they're doing and respect their culture and procedures.
For sure. And on that note, I know we get a lot of questions from residents of different items that are under kind of more of the jurisdiction of the Alberta government. So I know questions about closing the schools and different things like that. Can you kind of explain how that works and how we go about rolling that out within the community?
Alberta Emergency Management Agency is the lead agency on a day-to-day basis for the province. However, in this case, because COVID-19 is a health emergency, Alberta Health Services is the lead agency. In fact, I've worked with a number of the public health people. My background going back 18 years is with public health, so I'm very well in a pandemic such as this, the procedures, and they're really the experts. And across the country, we take that this is an international, a national, and a provincial, so there's a number of agencies, Health Canada, Public Health Agency of Canada, Alberta Health Services, that are all working together to respond to this. So when a health emergency is declared, it changes things a little than a state of emergency. And Public Health takes the lead on this, as well as Alberta Health, and they determine different things like the suggestions to close gyms, to close places where people come together, such as McDonald Island or perhaps a recreation center, and that's for people's own good. We don't want people being too close together, and by closing these places, and we realize it is an impact on the community. It's not a nice thing to do, but it's in the best interest. Having a whole bunch of people together in one center, possibly spreading the disease, creates a peak, and that causes an overburden on our healthcare system, which we don't want.
I know you've worked on kind of like health, I guess you would say, maybe not all pandemics in the past, but with health organizations and when you were in Ontario through your experience. I just want to know how COVID-19 compares to your past experience.
In fact, it's really interesting, and I look back, I believe it was 2006, 2007, when I worked on the Ontario Pandemic Plan. I was a contributing author of that, as well as there was a municipal county-based plan that I was an author of. And a lot of that work has really helped me understand and be prepared for this one. When I look at the growth of the pandemic, I'm not surprised. There's nothing yet that has shocked me. People ask me about how long this is expected to last, and I've said confidently 4 to 6 months. And that's based on the work that I did previously. And in fact, we want that because we don't want a huge spike. So doing things like social distancing, we enable that healthcare system to be robust and go through the waves of a pandemic, as opposed to everybody gets sick at once, healthcare is overburdened, and then we start looking into cases that become very severe and may ultimately result in death. We don't want that. We want to smooth out what's called the curve. Yeah, it'll take a little longer. However, that's the best way to keep our economy as well as health system going.
When we talk about flattening the curve, preventing the spread, you know, the regional municipality of Wood Buffalo has gone down to essential services model. Some other local businesses in town are taking the direction of the Alberta government and closing their doors or adjusting their services as well. What are some tips for residents that they can do to help flatten the curve and prevent the spread?
There's a couple of things. One is the ability to rally together, and maybe that's not actually sitting and having coffee with someone, but talking to a neighbor, picking up a phone and calling an elderly person or somebody that might be challenged with mobility in your community, down the street, maybe a neighbor. Hey, I'm going to the grocery store to pick up, can I help you out? And that doesn't mean we have to have an interaction. You could leave that bag of groceries on the porch, but you've helped out a neighbor. As a community, the power of helping each other is so much more than what I can do, or Alberta Emergency Management can do, or Alberta Health Services can do. So that's an example. The other thing that comes to mind is looking at your own interactions. So I know, for example, one of my favorite things to do is go to the gym. Gym's already closed, which is good. So I honor and respect that. So how can I get my workouts in on my own? And so respect the interaction, respect when you go into some place like a grocery store that's still open, that you're taking proper precautions, using hand sanitizer or washing your hands, and have that social distancing.
I think I've learned a lot, and I'm sure a lot of people at home have. Do you have anything else you would like to add?
Yeah, I think the main message I want to get across is this is a long-term incident. We had talked about that 4 to 6 months. So I urge you to remain calm. Take the messaging from Alberta Health Services. They really are the experts on this. And you can get more information on alberta.ca/COVID, as well as our own RMWB website. We routinely amplify the messaging from them, and really have patience. We take this as a government very serious. We're taking all steps to keep our government running, the government of RMWB, so that we can be there for our residents.